Thanks, Dr. Salcedo. So as Dr. Salcedo said, my name is Caleb Fiebig, and the title of my project is We're on the Right Tract, Diffusion Tensor Imaging Assessment of Epileptogenic Zone using Depth Electrode Locations to Investigate White Matter Tracts. So with that mouthful, I want to start by saying thank you to my committee, specifically my mentor, Dr. Thompson, Dr. Salcedo, and Dr. Stratford. I also want to thank the Modern Human Anatomy program, the faculty and staff for their support and instruction these past couple years, and my classmates for their moral support and going through this with me. Off with a little bit of a background of what is epilepsy. Epilepsy is a neurological which affects the neurons, which are the functional cells of the brain. And it results in recurrent seizures, which are disruption of motor control, altered behaviors, or altered states of consciousness, or any combination of those. And it's estimated that 30 to 40% of epileptic patients don't respond to medication therapies and are then termed drug resistant. And these cases are most commonly associated with the temporal lobe. So kind of as a reminder of anatomy, we've got temporal lobe on the left and the right. And if we take away this outer tissue of the temporal lobe, we find a structure deeper, highlighted in blue here, which is called the hippocampus, which is important in memory formation. And we'll kind of come back to this in a few slides. So how do we study the brain? First, we have electroencephalography, or EEG, which is pretty common practice to study the activity of the brain, specifically looking for abnormal activity. And it utilizes the electric nature of the brain to monitor this activity. So electrodes are placed along the scalp outside of the cranial cavity, and readings are made. The problem with EEG is it's not very accurate in giving us the activity of structures that are deeper within the brain because of its superficial nature. So to combat that, we have stereo electroencephalography, or SEEG, which we see over here in the CT scan. And what we can do is essentially take these electrodes and implant them in the brain as depth electrodes, which is what we're seeing here. So if we can get the electrodes closer to the structures that we're wanting to study, we get a more accurate representation of what's going on deeper. We also have diffusion tensor imaging, or DTI tractography, which utilizes MRI, which we can see over here, to measure the movement of water within neuronal tissue. And with that movement of water, we can give it directionality, which is coded with a color, with anterior posterior movement, left and right movement, superior and inferior movement. And we can stack those MRIs with the movement of water up, and we can create these beautiful 3D tracks that you see here representing the white matter networks of the brain. So if we have these ways to study the brain, what's the problem? Well, EEG and SEEG in their nature are only giving us information about the physiology of the affected neurons. They don't accurately identify which specific fiber bundles are actually being affected, though. So this can lead, it's more of a regional basis. So we know in this region that something's not going right, but we don't know that it's this specific fiber bundle going wonky. And the problem is this makes it difficult to pinpoint which regions of the brain are actually initiating or propagating the seizure activity, making it difficult for physicians and researchers to kind of hone in on where to either study or target treatment. DTI tractography, on the other hand, gives us a 3D visual representation of the fiber bundles, so it only provides a structural but not functional aspect of it. Correspondingly, it's been limited in its use clinically to pathologies that affect the anatomical structures of the brain, such as planning surgeries for tumors. So what if we could combine the data from SEEG with DTI tractography? And that was the question that our study sought to answer. So we hypothesized that if we could take the data from SEEG depth electrodes along with DTI white matter tractography, we could investigate and potentially locate shared networks across patients with drug-resistant epilepsy that might predict those susceptible networks. And as you can imagine, an accurate method of pinpointing where seizures are starting, where they're going, and if it's shared across people with drug-resistant epilepsy could provide an invaluable tool in treatment and study to improve patient quality of life. So to achieve this, we use DSI Studio to model and generate fiber tracks along with the electrode contacts. So that's what we see here. So here's a depth electrode, and it is modeled using these little balls in the brain. Each ball corresponds to an individual contact point on the depth electrode. Also in DSI Studio then, we were able to use the Atlas guided track recognition software to actually pull out from this entire tractography specific anatomical fiber bundles. So as examples, we pulled out the arcuate fasciculus, thalamic radiation posterior, and the optic radiation, among many other anatomical fiber bundles. And since drug resistance is associated with temporal lobe epilepsy, we decided to focus and hone in on the hippocampus. So we had to pull that out of the MRI data. So we threw the MRI and electrode data into FreeSurfer, which is a software that's able to go in and actually segment out brain regions. And so we segmented out the hippocampus, and it identified the electrode contacts that were found within the hippocampus. And then we were able to selectively generate the fiber tracks that were associated with each of those individual contacts, creating the hippocampal associated tracks that you see here. So now we've got these anatomical fiber bundles and hippocampal associated tracks, and we needed a way to actually compare them. So we got to do an actually pretty exciting new way of measuring and figuring out the dimensions of these anatomical fiber bundles using a shape analysis also within DSI Studio. And a shape analysis involved actually providing shape parameters to describe these fiber bundles, stuff like span, length, curl, which isn't shown here, but kind of describes how curvy the fiber bundle is, and elongation, which is also not shown, but kind of it relates the length to the radius and describes kind of how skewed the fiber bundle is. And our results showed that we had groups that showed some similarity and then groups that showed not so much similarity within the fiber bundles. And so if we were able to go in and pull out those fiber bundles that showed similarity, this is what we found. So 8 anatomical fiber bundles showed a significant number of fibers were shared with the hippocampus associated tracts out of about 23 total anatomical fiber bundles. So major tracts like the corpus callosum connecting the left and right hemispheres, arcuate fasciculus, uncinate fasciculus, and optic radiation all showed significant number of fibers shared. And then that led us to conclude that the combination of DTI with SEEG data is a really good method of bridging the gap between the physiology and neurology, or physiology and anatomy of the brain, in studying the neuropathologies like epilepsy that kind of have a combination of the two. And future directions that we'd like to take this study, obviously there's many other structures we'd like to study. We were limited to the hippocampus. We would also like to investigate the modality of seizure propagation. There's a couple of different currently argued hypotheses of how seizures are propagated, and then investigation of other neuropathologies. So with that, I want to thank you for your time. And are there any questions?
Thanks, Caleb. Fascinating talk. Really cool stuff here. Any questions for Caleb? So there hasn't been a lot of DTI use with these with epilepsy. Is that true, or is it one of the first studies that people have looked at with epilepsy, or?
Yes, as far as I was able to see in my research, and the main reason for that is because there's not a whole lot of gross anatomical changes that we see in the brain with epilepsy, and so nobody had applied and actually combined SEEG data along with the DTI white matter tract, and we haven't had a reliable way of actually measuring these fiber bundles to kind of compare between the two, or between different fiber bundles.
And do you think there'll be a change in these fiber bundles between patients who have epilepsy and who don't, or is it all going to be very individualistic?
That's one of the things that we actually had hoped to kind of get out of this. And then once we kind of dived into the project, we went from a pretty big scope to pretty small once we started applying some of these newer methods. That would also be something in the future that we would like to see. The problem with that is with this study, we're combining SEEG data with the DTI, and we're not going to be able to get data of SEEG on people that don't have epilepsy because it wouldn't warrant the procedure.
They don't want electrodes drilled into their brain.
Yeah, most people don't want holes drilled in their head for no good reason.
If it's for science, it's a very good reason. Any other questions for Caleb? All right.